Sometimes we take for granted how easy our medical system is when it comes to getting test results back in a timely manner. Much of this success is because of skilled laboratory technicians. Today we're visiting the laboratory at the Rutland Regional Medical Center to shine a spotlight on these individuals who play a crucial role in our healthcare system.
We have a staff of 72 people right now. That's broken up down to 24 phlebotomists, 21 medical technologists. They're the ones that process the blood and the urine samples to help provide a diagnosis for your doctor to look at. Their information, laboratory information, is one of the biggest parts on a patient's medical record that helps the doctor determine the plan of care for a patient. We also have a histology and cytology department. Histology that deals with if you have something removed from your body, a lump, a mass. They produce blocks that our pathologists look at to see what type of cells, if there's cancer cells, other malignancies. And then our cytology department also works with our pathologists in producing slides for looking at malignancies in cells.
It's Medical Laboratory Professionals Week, a time to say thank you and highlight the work of laboratory technicians who provide crucial information to doctors.
The technicians and technologists do most of the work behind the scenes. You see your phlebotomist or the registration person when you get to the hospital or a draw station. But then that sample disappears from you, and then we get it, and we do all the work that the providers really rely on those lab results before they make any kind of decision on your health care. And we do that 24 hours a day, 7 days a week. And you don't always see that when you've come and gone from the facility, and then your doctor gets the results. There's a lot of hard work and quality that goes into those results to make sure that your health care is taken care of.
The amount of testing that takes place inside this third-story laboratory at Rutland Regional is impressive. With more than 455,000 tests run last year, it's evident the role lab technicians play.
Well, once the blood is once the blood is drawn, or other body fluids, we do urinalysis, we do stool testing, sputum cultures, all kinds of things like that. Once the specimen is collected, it comes to the laboratory. There's usually a pre-processing step. With blood, it may be centrifuged so we can get the plasma or the serum from it. And then it is placed on an analyzer most of the time, where it's processed depending on what the test is. There's many different types of tubes that are drawn depending on what the provider orders. And then that analyzer will process the sample and get results, and then the tech will review the results, and if they look appropriate, then approve them, and then those results go to the provider's chart or their EMR or on paper or however they get them.
It's their information along with DI that guides the doctor. It's our results that indicate if you have diabetes, if your glucose levels are really high or really low, to tell the physician what type of medicines you may need. If you're on a medicine, are you taking them properly? Have you overdosed, accidentally and need to lower your prescriptions? It's our results tell if you have a UTI, if you're pregnant.
Rutland Regional employs 72 people in the laboratory. It operates 24 hours a day, 7 days a week.
We're kind of the hidden people in the hospital. You don't know we're here doing all the work behind the scenes.
Electronic medical records have helped speed up the process, but it's not as easy as you may think to make all the information move from one place to the other.
There's a lot of behind-the-scenes work to make that electronic process happen, but it certainly speeds up the time it takes to get the results to the provider. So the time from blood draw to your doctor actually looking at the results is significantly quicker than it has been for many years.
Medical Laboratory Professionals Week celebrates the people who keep the engine running behind the scenes.
There's such a wide range of laboratory staff that it really appeals to a lot of different people. We have everything from pathologists to our medical doctors to lab technologists. We have phlebotomists, we have couriers, we have administrative staff. A lot of parts in the laboratory clock, a lot of cogs in there that keep it running.